Good morning. It gives me a great pleasure and encouragement to have a leadership of our medical school, first of all, Dean Goldschmidt and Dr. Neimer, the director of Sylvester Comprehensive Cancer Center, because without their support, we would not be doing a lot of things that we do here. Obviously, a very, very, very special, heartfelt thanks to Andre Dawson. Obviously, he needs no introduction. But for someone like me who did not necessarily grow up in this country, he is a true legend both on and off the field. I had the pleasure and the privilege of seeing Mr. Dawson in December of 2012. He came to us because he had a diagnosis where his PSA test, a simple blood test, the PSA test was elevated, and he came to us for further counseling about that. We discussed in detail the pros and cons of PSA testing and screening for prostate cancer. As we all know, there's a considerable debate in this country as well as in several other countries whether screening for prostate cancer is really beneficial or not. And there are pros and cons, and you can argue several ways. But in someone like Mr. Dawson, screening absolutely made a lot of sense. Because of his ethnicity, he's an African American, and as we all know, the incidence of prostate cancer is higher in African American men. He's in the prime of his life, as we can all see. He's in terrific shape, and let's say if this cancer had to hurt someone, the ideal person, or this is the type of person where you really don't want it to hurt. So we went through the pros and cons. We actually advised him about biopsy. He was a wonderful patient. He is a wonderful patient. Without any ado, he underwent a prompt biopsy of his prostate gland that showed cancer. As you can imagine, the worst part of our job as physicians and as cancer surgeons and as doctors who take care of patients with cancer is to break a diagnosis of cancer to the patient and his family or her family or their families for the first ever time. It was no different except that it made it even a little bit more difficult considering that that patient was Andre Dawson. But both Mr. Dawson and Mrs. Dawson took it in their stride. We went through a lot of treatment options that included active surveillance, which means we don't actively treat the cancer. We watch it and monitor it very closely, and should the cancer either grow or change its colors, we can then initiate treatment. Given how young he is and how much he has to lose, if he loses a window of cure, they treated that not to be an option. We discussed about radiation, we discussed about surgical options, and Mr. Dawson, after all the discussions, decided to go the surgical approach. That's where we offered him the robotic surgery, or robotic prostatectomy, that was performed on him on December the 18th. He had a wonderful post-operative course, very smooth. He went out of the hospital in a couple of days. And here he is in front of all of us. He is about 4 or 5 months out. His PSA test, which is a superb marker after surgery for presence or absence of cancer, is undetectable, which means he's cancer-free. He looks great. He's back to doing all the things that he always did and liked to do in his life. He's back on the field, with very heavily involved with the Marlins and the wonderful game of baseball. And when I spoke with Mr. Dawson after his first PSA came back as undetectable, and I requested to him that it is individuals and legends like him who can make a difference and send a message out about this disease to a lot of men and their families. He was again the perfect gentleman and was willing to talk about this in a public setting and help several hundreds and thousands of men, both in the United States and everyone else who follows him all over the world, to come out and get the testing done. And that's what it is. I just want to say that we did the surgery by the robotic approach. We have 3 state-of-the-art robotic systems here in the UHealth system. The Sylvester Cancer Center bought one specifically a few months back when I was recruited here, and it's just been an absolutely wonderful treating all these patients here. We were just recently, very recently, named as a case observation site for robotic surgeries for prostate cancer, kidney cancer, and bladder cancer for physicians and doctors from all over the world, Caribbean, Latin America, and the United States. So again, extremely humbled and proud to be taking care of such an icon, the perfect patient if you can never describe one. And without any further ado, I think the world needs to know more from him than they do from me.
Thank you. Good morning. You know, being an ex-athlete, I've endured a lot of challenges throughout the course of my career. For the most part, that being going through a lot of knee issues. As a player, I endured 12 knee operations during my 20-plus year career. And post-career, I had 2 replacements. So it appeared that every challenge that would come my way, I was up for the task. And I took to heart really doing what was, in essence, was necessary to get better right away. I'd always been a quick healer, and I felt that whatever challenge is presented my way, I'm going to tackle it head on and make the best of it. I told Dr. Simon, the team physician, well, your work is cut out for you because you're going to have to find me someone good before I go in and sit down and have to listen to what I'm dealing with. He recommended Dr. Parrick. He said, well, we can do radiation or we can do the robotic surgery. And I said, I want it out of my body. I said, you know, with the radiation, the prostate is still there. It may or may not come back, but the prostate is still there. I want the prostate out. And he smiled at me, and the first thing he said is, you're gonna do well, you're gonna do fine. But I was scared to death. It's no secret, because when you think of cancer, you start thinking about, well, how much time do you have? Because you never know. And he assured me, he said, you're gonna do fine. I think if it can be detected early enough, in my case, it was detected early enough where I was able to, as Dr. Parrick would say, get through it and be cancer-free. And it was a scary experience for me. And I look back and I think of all the staff. I remember being on the floor up in my room and walking the floor, seeing the different cancer patients, and just thinking, wow, you know, this is me. And how cordial everyone was, from the receptionist to the therapist to the nurses to Dr. Parrick's office staff, how they all smiled and said, you're going to do fine. And I said to myself, I said, you know what? I said, wow, is the attitude of a doctor to say things to be encouraging or supportive just to make you feel good? Or is there really a lot of meaning to it? And Dr. Parrick, you know, thank you very much. I can't say enough for, you know, what I've endured over the last 4 months. How it's changed my life to a degree. How I look at things in a different perspective now. Before you, I just thank the entire staff here at the Sylvester Cancer Center for the role that they played, how encouraging and supportive they were in helping me endure and get through the process. Thank you again.
It's a great privilege for me to be up here to represent the Cancer Center, to acknowledge the careers of 2 incredible individuals, the doctor and the patient. I think we all would like our accomplishments in life to mean something. And so we all work very hard at our professions. And if we're lucky, we can have an impact. And so I think your career can now impact on patients throughout the country who are dealing with the diagnosis of cancer and trying to find their way. So I thank you very much.
To join my colleague in thanking you, Andre, for the wonderful words and for your courage, for your amazing understanding of what it means for so many people for you to speak up and to talk about the danger and the opportunity with treatment for patients with prostate cancer. I was blessed with the opportunity in July of 1999 to bring the very first Da Vinci robot in the United States that was used for your surgery. And the day before that, there had never been a robotic surgery done with a commercial prototype of the robot in the United States. And now more than 80,000 patients like you go through prostatectomy with the robotic technology every year. Bottom line is that as long as people get a yearly checkup, as you did, and find out the cancer early, champions like my friend Dipan Parekh, who is really the best robotic surgeon in the United States, have the ability with that technology to take the cancer out once and for good, and to give you the opportunity for a great life after cancer. And so, again, on behalf of University of Miami, the Miller School of Medicine, the Sylvester Comprehensive Cancer Center, and all of the patients that you will help in the future because of your words and your courage, we thank you.
Obviously now coming out and talking about this publicly, I wonder, since the team's been back together in spring training, I know you've been around a lot, have you started to, send that message about awareness, and I guess have you started to spread that message at all?
Yeah, I addressed the minor league personnel in spring training.
Mm-hmm.
There was an individual that came down and prior to a workout went over the importance of prostate and PSA screening. And well, for me again, it was a no-brainer. When I found out that he was there and he was going to talk to all of the minor league personnel, then I went outside and kind of did a testimony to them, with them. And it kind of really, in hindsight, made it a lot easier for me now to come here today, because people saw that I had lost weight and I was looking a little frail. And I wasn't afraid, being private as I am, I wasn't afraid to say, well, I just went through the procedure, But I'm at the point now where I'm trying to get back to where I was, and everything appears to be encouraging.